Ketamine. It's one of the most widely used anesthetics in the world, yet it's also one of the most misunderstood substances in recreational drug culture. So, what exactly is ketamine? Classified as a dissociative anesthetic, ketamine was first synthesized in 1962 and approved for medical use in 1970. It's known on the street by names such as K, Ket, vitamin K, and Kit Kat. It comes in several forms, including liquid, powder, and tablets. Ketamine belongs to a class of drugs known as dissociatives. These substances work by disrupting communication between the conscious mind and other parts of the brain, creating a sense of detachment from one's body and surroundings. It's important to understand the different forms ketamine takes. Medical and veterinary-grade ketamine is a clear, sterile liquid produced under strict pharmaceutical standards. Street ketamine, on the other hand, typically appears as a white crystalline powder and may vary significantly in purity. Then, there are synthetic mixes which can contain unknown adulterants and pose additional, unpredictable risks. Ketamine can be administered through several routes. Intravenous injection delivers the fastest onset, but carries the highest risk. Intramuscular injection is common in medical settings and provides rapid absorption. Snorting is the most common recreational route. Oral ingestion has the slowest onset and is less predictable in its effects. The effects of ketamine are highly dose-dependent. At low doses, users may experience stimulant effects and mild dissociation. Medium doses produce stronger dissociative effects, visual disturbances, and impaired coordination. At high doses, ketamine can induce what's known as a K-hole, a state of profound dissociation, where the user may feel completely detached from their body and environment. Understanding how ketamine works requires looking at its mechanism of action. Its primary target is the NMDA glutamate receptor, which it blocks, disrupting normal neural signaling. But ketamine doesn't stop there. It also interacts with noradrenaline, dopamine, and serotonin systems, cannabinoid receptors, sigma receptors, and opioid receptors. This complex pharmacological profile explains the wide range of effects users experience. In the short term, ketamine produces both neurological and physiological effects. Neurologically, users may experience dissociation, hallucinations, confusion, and altered time perception. Physiologically, effects include increased heart rate and blood pressure, nausea, impaired motor function, and in some cases, respiratory depression. Long-term or chronic ketamine use can cause serious damage to multiple organ systems. The urinary tract is particularly vulnerable, with regular users developing a condition known as ketamine bladder, which causes severe pain, urgency, and in extreme cases, requires surgical intervention. The liver, kidneys, cardiovascular system, and gastrointestinal tract can all suffer significant harm from sustained use. Beyond physical health, chronic ketamine use carries substantial psychological and cognitive risks. Users may develop persistent cognitive fog, struggling with memory, attention, and decision-making. Mood disorders, including depression and anxiety, can emerge or worsen. In some cases, ketamine use can trigger psychotic episodes. Perhaps most concerning is the development of psychological dependence, where users feel unable to function or cope without the drug. If you or someone you know uses ketamine, harm reduction is essential. First, always test your substances using reagent testing kits. Second, start with low doses and wait before redosing. Third, never use alone. Always have a sober companion present. Fourth, stay hydrated but avoid excessive water intake. And fifth, be aware of dangerous drug combinations. Mixing ketamine with alcohol or other depressants significantly increases the risk of respiratory failure. For those seeking help, the first step is medical assessment and stabilization. This is followed by a structured detoxification process. Next comes therapeutic intervention, including counseling and behavioral therapy. Finally, ongoing aftercare and support complete the pathway. Referral routes include NHS services, specialist addiction clinics, and community support organizations. This presentation was produced by TD Training and Consultancy Limited. Thank you for watching.